Hello, this is Trey from Target Pharmacy. I'm calling for Mrs. Red.
This is she.
Hey, Mrs. Red. Like I said, this is Trey, the pharmacist at Target Pharmacy. I was calling you today just to go over your medications and see if you had any questions or anything. So to start off, how have your medications been working for you?
They're fine, thank you.
Okay, great. Glad to hear things are going well for you. Have you experienced any side effects or anything that you'd like to ask about?
No, everything seems to be okay.
Okay, great. Glad to hear that. Well, more specifically, I was calling you today about your atorvastatin. I was wondering if you're still taking that medication.
I think so.
Okay. It looks on here that you filled that 3 weeks ago for a 90-day supply. The reason I was calling you was just to see how you were taking that medication. So, how did your doctor tell you to take that medicine?
Is that the one for my cholesterol?
Yeah, you know, that is for your cholesterol. It's actually good for other things as well. For diabetics, it actually helps prevent heart attacks and strokes. So it actually does more than just your cholesterol.
I didn't know that.
Yeah, so it is a good medication for you to take. And I was wondering, when did your doctor tell you to take that medicine?
He said any time would be okay.
Okay, yeah. Yeah, you can take that medication anytime. A lot of times they'll tell you to take it in the evening, but you actually don't have to. You can take that one in the morning as well if it helps you remember. The most important thing is that you're just taking that medication every day. Do you ever feel like you have a hard time remembering to take that medicine, or do you have a pretty good routine?
If I have to take it in the evening, I do forget to take it.
Okay. So then what they're like I said, that one, if you take it in the evening, you know, some people do struggle with that because it's off of all their other medicines they take in the morning. So you are able to take that one in the morning with your other medications without making it easier for you. So do you think that's something you'd like to try, was taking it in the morning?
I think I could do a lot better if I took it in the morning with my other medication.
Okay, yeah, definitely. That's something you could definitely can try. It's not going to make it, any less effective. So the most important thing is just taking that medication daily in the morning. So to wrap up, do you have any other questions for me or anything before I let you go?
No, I think it's all okay.
Okay, great. So to conclude, what I talked about is that atorvastatin, the generic Lipitor, that medication you can now take in the morning, and it's good for your heart as well as your cholesterol because it does help prevent heart attacks and strokes. So I do appreciate your time today, and if you have any questions, feel free to give us a call back here at the pharmacy. We're open until 7 o'clock. Okay?
Thanks for calling.
All right, thanks, Ms. Red. Have a good day. Bye-bye. Okay, so that was a adherence check-in with a barrier identified, which was taking the medication in the evening and was causing her to forget to take the medication. So now we'll move on to a adherence check-in call with no barrier, just so I can show you kind of the flow of the conversation. Good morning, Mrs. Red. This is Trey, the pharmacist. How are you doing today?
I'm fine, thank you.
Good, I'm glad to hear that. I was calling you today just to go over some of your medications to see if you had any questions for me. So to start, have your medications been working well for you, and do you have any questions that I could answer for you?
They're just fine. I don't have any questions at all.
Okay, great. So how do you organize your medications? Do you have just a daily routine where you take them with breakfast and dinner, or do you use a pill box? Just tell me a little bit about that.
I use a pill reminder.
Okay.
I take most of them in the morning.
Okay, gotcha. Do you use a daily pill box, or is it a weekly pill box?
It is a weekly pill box.
Okay, great. I see it looks like you're taking 4 different medications here, the metformin, atorvastatin, lisinopril, and then you also take the, looks like hydroxychloroquine. Is that correct?
That's correct.
Okay, great. So the medication I want to talk to you about today more specifically was the lisinopril. Do you remember what the doctor told you that medication was for?
Well, he prescribed it for my high blood pressure.
Okay. Yeah, that's correct. Lisinopril is a blood pressure medication. That it is an important medication for you to take to help manage your blood pressure. It also has good protective qualities for the kidney, and it also helps prevent strokes in people that have diabetes. So my question for you is, when do you take that medication?
First thing in the morning.
Okay, very good. That's most people do take that medication. Have you experienced any side effects with it that you'd like to ask me about, or has it been working well for you?
I've had no problems with it at all.
Okay, great. And I know you said you use the pill box, so do you, using the pill box, do you find that you take that medication easily every day?
Absolutely. I never miss a dose.
Okay, great. Well, I'm glad to hear that. It sounds like you're really on top of things and you know what your medications are and how you're supposed to take them. So that's really good. So before I let you go, do you have any questions for me that I could answer in any of your medications?
No, I don't have any questions at all.
Okay. Well, just to let you know, it looks like you have about 2 refills left on each one of your medications, except for the hydroxychloroquine. We'll need to get a new prescription for that next month. So, I can go ahead and reach out to the doctor for you and make sure that gets set so you don't run out of the medication. Does that sound good?
That sounds great. Thank you.
All right. No problem. Well, I appreciate your time today and you have a great day.
You too. Thanks for calling.
No problem. Bye-bye. Okay, so that was your standard adherence check-in call with no barrier identified. A lot of our older guests will use pill boxes, so all you have to do is just go in and document no barrier identified, but you did provide the patient education and you did provide adherence reminders as well. So the last one we'll do is the high-risk medication, which we're going to probably do Ambien because that's the one we see most often. So listen in and I'll do the last call here. Hello, Mrs. Red. This is Trey, the pharmacist. How you doing today?
I'm fine, thank you.
Good. I'm glad to hear that. I was calling you today just to go over your medications with you if you had a minute and just see if you had any questions or any side effects you'd like to talk about. Is that okay?
Sure.
All right. Sounds good. So to start, I'm looking at your prescription profile here, and do you have any questions on your medicines about how anything works or how many refills you have left, anything like that?
No?
Okay. Well, as far as your refills go, it looks like your doctor sent over new prescriptions last month, so we do have enough. You don't have to worry about calling him for any refills. Now, the next question I have for you is regarding your Ambien prescription. Do you know what you take that medication for?
Yes, because I can't sleep at night.
Okay, you're right. That medication is for sleep. How do you feel it works for you?
It works pretty well.
Okay. And do you know when your doctor told you to take that medication?
At about a half hour to an hour before bedtime.
Yeah, that's correct. Most people take it a half hour to hour before bedtime, and it does help. People would fall asleep, which is obviously important. But the reason I was calling you today was to see if that was a medication you'd be willing to try to start weaning off. Only reason I'm asking is because it's on a list of medications that's actually shown to increase your risk of falling and getting injured, and more specifically hurting your hip. So that's the reason I'm calling today, just because they call it a high-risk medicine because it does increase your risk of falling at night because of the way the medication works. So do you think that's a medication you'd be willing to try to wean yourself off of, or how do you feel about that?
Well, I don't know about that. I've tried a number of other ones and they haven't worked very well. This one at least works most of the time, and I don't seem to be dizzy or disoriented in the morning.
Okay, not a problem at all. It's definitely 100% your choice. I just wanted to call and reach out to you to inform you about that and let you know the risks. I know it does help you sleep well, which is important. So how would you feel if maybe a month down the road I call you and see if you're willing to make a change at that point? Does that sound like something that you'd be willing to try?
Well, you could give me a call then and we'll see if it's still working. If it's not working at that time, maybe I would be willing to discuss something else.
Okay, sounds good. So I'll put a note here, just give you a ring in a month or so, and we'll have the same conversation and see how you're feeling about it. Once again, it's totally your decision. We're not gonna stop your medication for you, but we did want to reach out to you and see what you thought about it. So basically, how the process will work is we'll call you in a month from now, and we'll see if you're willing to try to wean off. And there are other options that are more safe that we could try. So at that point in time, if you do agree to it, we can reach out to your doctor and we'll come to some sort of agreement and maybe another medication we could try that is less risky for you. Does that sound good?
That sounds okay.
Okay. All right. Well, do you have any other questions on any other medicines today?
No, that's it.
Okay. Well, I do appreciate your time, and we'll see you here shortly, okay?
Okay, thanks for calling.
All right. Thanks. Have a good day. Bye-bye.
You too.
Okay, so that was our high-risk medication call. The most important takeaways from that are just to make sure the patient's in control. You don't want to feel like that you're making the decision for the patient. Just let them know they have time to think about it if they're not willing to wean off, because most people aren't going to be. I hope that helps. Thanks.